You're welcome to Excellent Simplified Tutorials.
Today we are going to look at chemotherapeutic agents. Chemotherapeutic agents. And when we say chemotherapeutic, what do we mean? Treatment of cancer, right? Good, basically. So chemotherapeutic agents, we are going to look at basically substances we can use, medications we can use to treat cancer. But what is this cancer? Abnormal growth of cells, right?
Yes.
Cells that are dividing. You cannot control the rate of division of the cancer cells. It's not that you have a foreign substance coming in. Your cell dividing uncontrollably. That is cancer. Uncontrolled growth of cells. That's cancer. So if that part of the cell, one cell is dividing at the rate you cannot control abnormally, that is cancer. Now, what are some drugs we can use in controlling cancer or in treating cancer? That is chemotherapeutic agents you want to look at. Do you get that? But now the issue here is, most times when you use cancer medications, chemotherapeutic agents, some of the cells that are actively dividing but not cancerous cells are affected. The medication is to affect cells that are actively dividing, cancer cells. But not all actively dividing cells are cancerous. But the medication will just look for any cell that is actively dividing and we affect that cell, which is a negative side effect of the drug. So we'll look at that. But modern chemotherapeutic agents, they've looked for ways to affect only the cancerous cell and leave the other cells apart. Now they notice something. They notice that cancerous cells, they need more nucleotide. More nucleotide. When I say nucleotide now, we know what it means, right? They need more nucleotide. They require more nucleotides than normal actively dividing cells. So modern chemotherapeutic agents now, what they do is either they concentrate the chemotherapeutic agent at the particular site of the tumor. That is, if this is, let's say the cancer is here. No, not my hand. If let's say the cancer is here. Now, this is a particular spot where the cell is actively dividing. They can physically concentrate the chemotherapeutic agent on this spot. Do we get? Physically concentrate that chemotherapeutic agent on this spot, so it will affect only the cells actively dividing here and not the whole body of the organism. Do you get that? All right. Now, the classes of chemotherapeutic agents, you should take it very serious because you'll likely see this. The classes of chemotherapeutic agent, number one we say is what?
Antimetabolites.
Anti. Anytime you hear anti, I used to be afraid of them. They say anti. I'm afraid of them. Anti means what? Against, right? So antimetabolites are against what? Metabolism, right? Antimetabolites are against metabolism. Substances that act against metabolism. Do we get that? Now, we know that it is from metabolism that cells divide actively, right? Is it not? Cells divide actively through metabolism. Now, if we have some drugs that can inhibit metabolism, that can stop metabolism, then possibly they can stop cancer. Do you get? Because if metabolism is not taking place in the cell, you know, metabolism is building up and breaking down, right? Metabolism is equal to anabolism plus catabolism, is it not? Now, if we can stop that metabolism in the cell, that cell cannot actively divide again, because energy, first of all, will not be supplied for it to divide. So the first class of chemotherapeutic agents here is antimetabolites, those that act against. And we said they are what? There is one statement I gave you there. The first statement I gave you. They are analogs of what? Purines and pyrimidines. They look like purines and pyrimidines, but they are not. They look like purines and pyrimidines. So now look at it this way. These are structural analogs of purine and pyrimidines. And when we want to incorporate the bases into the nucleotide, we can incorporate them because they look like, I don't know if you get what I'm trying to say. They look like the purine or pyrimidine bases. So when we want to synthesize our nucleotide now, we can incorporate them thinking it is the normal base. And if we incorporate them there, the enzymes involved in that pathway cannot metabolize them. And so the nucleotide cannot be formed. The reaction cannot take place. The pathway is inhibited. For example, 5-fluorouracil. 5-fluorouracil. I believe in this class we can all draw uracil, right?
Yes.
Uracil, is it a purine or pyrimidine?
Pyrimidine.
Pyrimidine, right? Let's draw it together. Carbon, carbon, carbon. Nitrogen, carbon, nitrogen. Good. Then we put our, and I said all the pyrimidines have double bond oxygen here, right? Good. Now for uracil, what is double bond oxygen here, right? No, if I put methyl group, that is thymine. So this is our, you complete your hydrogen, and that is our, this is our purine, right? If these are uracil, if I'm numbering this, where do I start my numbering from? Is it here? Yeah. Yeah, right? 1 clockwise, right? 1, 2, 3, 4, 5, 6. Now if this is uracil, 5-fluorouracil, meaning we are attaching fluorine on position 5, right? Now if you look at it, it's structurally looking like uracil, but we've attached a group here. Now when this 5-fluorouracil, which is a chemotherapeutic agent, is taken in, what it does is it is converted in vivo in the cell. Now it is converted, an enzyme converts it into fluorodeoxyuridylate. Now when you say uridylate, uridylate is the same thing as uridine monophosphate. Adenylate is the same thing as adenosine monophosphate. So guanosine monophosphate is the same thing as what? Guaninate, right? Yes. Now so fluorodeoxyuridinate, that is fluorodeoxyuridine monophosphate. Now good. Deoxy here means, is it supposed to be in DNA or RNA? Yes. DNA. Thank you very much. Now in vivo, that is in the cell. Now this 5-fluorouracil will be converted to fluorodeoxyuridine monophosphate. Now this, remember, an enzyme is converting it to this. This fluorodeoxyuridylate now will inhibit this enzyme thymidylate synthase. An enzyme involved in the synthesis of what? Thymidine what? Monophosphate, right? Remember when we are looking at the pathway of pyrimidine de novo synthesis, we synthesize thymidine from uridine monophosphate. First, we converted uridine monophosphate to uridine diphosphate, like that, right? From there, what did we do to get? We added what? Glutamine. What's the difference? What is the structural difference between uracil and thymidine? We added methylation, right? If you add a methyl group to this, if you add a methyl group to uracil, you have thymine, is it not? So methylation reaction is what takes place there. But now this enzyme inhibits the formation, this enzyme, this fluorodeoxyuridylate inhibits thymidylate synthase, and so pyrimidine cannot be synthesized. That pathway is inhibited. And we said it is a classic example of what? Suicide what? Suicide inhibition. Now this enzyme causes this enzyme catalyzes the formation of this. Now catalyze the conversion of this to this. Now as it catalyzes the conversion of this to this one, now the product formed from its own metabolism is now inhibiting it. You see that it's suicide because what is killing him? No, sorry, what is killing her is what? She's a she here, please. She's a she. Now what is killing her is her own product. Do you get? So it's suicide. She's converting this to, this is a she. All right, so thymidylate synthase, this the inhibition, we can see now that this is inhibited. Pyrimidines cannot be synthesized, and if pyrimidines, remember that cancerous cells, they require more nucleotides, right? They need more nucleotides, and so since we cannot synthesize our base now, nucleotides cannot be formed. That pathway is inhibited. Antimetabolites. Other examples of antimetabolites, please, tomorrow you can see it. List so examples of or classes of chemotherapeutic agents. The classes I've given you how many? Just one, right? Antimetabolites. We'll look at others. Or the question can say, give the classes of chemotherapeutic agents with 3 examples each. See how they can say, question will come from this. Just have it in your mind. Question must come from this because this is a topic. Good. Another example is 6-mercaptopurine and 6-thioguanine for the treatment of acute leukemia. What is the difference between when they say something is acute and something is chronic? Acute is short term. Chronic is long term. Acute, that short term can do you what you don't like. Short term, but it's powerful. Chronic can just be killing you small, but acute, sudden. Now, acute leukemia, we can use 6-mercaptopurine and the rest to treat this. What's leukemia? Cancer of the what? Blood, right? Mm-hmm. We know leukocytes are what? White blood cells. So we can use this, and it works as an antimetabolite also. Azothioprine for immunosuppression in patients with organ transplants. So after doing organ transplant, they can use this to prevent cancer. The next one there is allopurinol. Allopurinol is very common. In fact, in that pathway, you see that it inhibits what enzyme? Xanthine oxidase. Thank you very much. Allopurinol inhibits xanthine oxidase, and you remember that in the breakdown of purine, the end product of the breakdown of purine is what? Uric acid, right? Good. And the last enzyme catalyzing that reaction is what? Xanthine oxidase, right? Good. Xanthine oxidase. Now, allopurinol is used for the treatment of gout and hyperuricemia. Last time I made mention that gout is caused as a result of accumulation of what? Uric acid, right? Urate crystals. So if urate crystals accumulate, meaning it's overproduced, hyperuricemia, excess uric acid in the blood. Now, what can cause excess uric acid to accumulate in the blood is too much breakdown of purine, right? Yes. Good. And the enzyme catalyzing that reaction is what? Xanthine oxidase for the production of that uric acid, is it not? Yes. Now, if we want to stop that, allopurinol is a chemotherapeutic agent that inhibits that xanthine oxidase so that the final step of purine breakdown cannot take place. And so more uric acid will not accumulate. Antimetabolites. Another one here, acyclovir, is used for the treatment of what? Herpes virus, right? Cytosine arabinoside is used in the treatment of several forms of cancer. Now, basically, if you are asked to list examples of antimetabolites as chemotherapeutic agents, number one you will list is what? 5-fluorouracil. Number 2. Number 3. Anyone you can mention from here. But me, I will advise you, if you are listening, make sure this one enters. They are very common. Even acyclovir is very common too. So at least these three. All right. So basically, that's that. Can we move on to the next? So the first class of chemotherapeutic agents are number 1 is what? Antimetabolites. Example, 5-fluoro. Another one. Allopurinol and the rest. Yeah. Some of you are tomorrow, as you want to reason, just hear. Please say something. Good. Now, the second class, hello. The second class is antifolates. Folates, yeah, you know we are talking about folic acid, right? Antifolates. Now, antifolates are chemotherapeutic agents that inhibit the formation of what? Tetrahydrofolates, right? They are structural analogs to folic acid. They inhibit the formation of tetrahydrofolates. And remember, in the synthesis of purine, we need tetrahydrofolate, right? Tetrahydrofolate derivative provided carbon what and carbon what? Carbon 2 and carbon 8. Carbon 2 and carbon 8, right? But now, these antifolates will inhibit the formation of tetrahydrofolates. And so if tetrahydrofolate is not there, what will now provide carbon 2 and carbon 8 for the synthesis of the base? So the base will not be synthesized. And so the nucleotides that this cancerous cell need to actively divide will not be there. Now, the enzyme, particular enzyme involved is dihydrofolate what? Reductase. So this dihydrofolate reductase reduces dihydrofolates to tetrahydrofolates. That's the work of this enzyme, to reduce dihydrofolates or folates to tetrahydrofolates, which we need. Now, example of antifolates is methotrexate. Methotrexate. Now, this methotrexate acid, or you call it methotrexate, is very similar structurally to what? Folic acid, right? It's very similar to folic acid, and it competes with what? Competitive inhibition, right? It competitively inhibits this enzyme. You know, enzymes have active site, right? Enzymes have active site. Now, this substrate is supposed to bind to the active side of this enzyme so that catalysis will take place. But this methotrexate have a similar shape to this. Remember when we talked about types of inhibition? Competitive inhibition occurs when the substrate and the inhibitor have similar shape, right? And so they can both bind to the active side. That was what we said. Good. Now, this methotrexate and dihydrofolate have similar shape. And so both of them can fit into the active site of dihydrofolate reductase. So this one competes with dihydrofolate to bind to the active site of dihydrofolate reductase. And once it binds, it will inhibit this enzyme. So the pathway will be inhibited. Tetrahydrofolate cannot be produced again. Same thing happens with aminopterin. They inhibit this enzyme so that this tetrahydrofolate cannot be formed. And if tetrahydrofolate cannot be formed, our base cannot be fully formed. And so cancerous cells that needs that nucleotide cannot be supplied with the nucleotides they need. And that will inhibit that pathway. So inhibition of that pathway now will lead them not to multiply again. Are you seeing how they are involved in cancer treatment now? They inhibit the multiplication of that cancerous cell. Do you get that? The first class of chemotherapeutic agent, number 1, we said is what? Antimetabolites. Number 2, antifolates. Example of antifolates is what? Methotrexate, right? Good. Why? An example of antimetabolites is what, sister you? Is what? An example of antimetabolites is what? 5-fluorouracil, right? No, carry your head down. Alright, so now number 3 now, glutamine antagonist. You agree with me from our idea of protein metabolism, or there is no idea? Now, from our idea of protein metabolism, when we talk about transamination, we know that glutamine is a very important molecule, right? Glutamine is a very important molecule. In fact, in the synthesis of nucleic acid, glutamine provided in, synthesis of purine, glutamine provided what? Nitrogen what? 3 and nitrogen what? 9, right? Nitrogen 3 and nitrogen 9, glutamine. Amide nitrogen of glutamine provided that. Very, very important. Now, anti-cancer drugs, chemotherapeutic drugs, these ones that are glutamine antagonists, they will not notice. They say, after checking the pathway, they say, oh, glutamine is doing a nice job here. So glutamine is what is the person supplying them with nitrogen 3 and nitrogen 9. Let's do something to this glutamine so that glutamine will not be there to provide nitrogen 9 and nitrogen 3. Are we following it? Carbon, 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 nitrogen, carbon, nitrogen, carbon, nitrogen, carbon, nitrogen, carbon. If you are numbering this, where's my 1? 1 here, right? 1, 2, 3, 4, 5, 6, 7, 8, 9. And we said nitrogen 1 was from what? Aspartate. Carbon 2 and carbon 8 was from what? Tetrahydrofolate derivative, right? Carbon 4, 5, and 7. Glycine. Nitrogen 3, nitrogen 9. Glutamine, carbon 6. Carbon dioxide, good. Now, nitrogen. This nitrogen 3 and nitrogen 9 by glutamine. Now, glutamine is very important here. Because if glutamine is not there, where do we get nitrogen 3 from? Where do we get nitrogen 9 from? In fact, the first thing that was formed was nitrogen what? Nitrogen 9 was the first thing formed in purine synthesis. Nitrogen 9 by glutamine, is it not? Now, they now studied and said glutamine is very important there. In fact, glutamine is the one starting the pathway to synthesize purine. Meaning anything we do to inhibit, to remove glutamine, that pathway cannot be synthesized. That purine cannot be synthesized. So, glutamine antagonists are chemotherapeutic agents, very dangerous ones, toxic. It's not to be used clinically, not for the reach of children. Now, glutamine antagonists, what they do is they antagonize, they fight against glutamine, right? Example is what? Azathioprine and what? 6-diazoxyl-L-nolisine. So what they do is to antagonize, is to fight against glutamine. And we've seen the importance of glutamine. The next one, we classify them as other agents. And we say, what are other agents? Other agents, we are anyone that does not fall into the 3 other classes we mentioned. We just group them as other agents, other chemotherapeutic agents, right? I would say they interfere with what? Nucleotide metabolism. You see how nucleotide is important for cancerous cells to multiply. So, other agents also interfere with nucleotide metabolism. Good. Now, in the antimetabolites, there are 2 antimetabolites that have been identified to treat or control herpes virus. Herpes virus is HSV and HIV. So it's used, 2 antimetabolites have been used to control these two viruses, but they cannot be used to cure. Remember, looking at the characteristic of a virus, is virus a cell? Yes. Okay, does virus have a cell?
Yes.
Virus have a cell? It's a lie. Virus is eukaryotic. How do I spell them again? It's eukaryotic. You know, we have prokaryotic, we have eukaryotic. Viruses are eukaryotic. In fact, they are described as naked cells. That is if we want to classify them as a cell. But looking at, there are 3 things something must contain before you can classify them as a cell. And virus does not contain those 3 things. 1, a cell must have a limiting plasma membrane. That's cell membrane. Viruses lack cell membrane. True or false? They don't have cell membrane. A cell must have a metabolic machinery. Viruses lack metabolic machinery like mitochondria and other things. They lack them. The 3rd thing that must be seen for you to classify any substance as a cell is presence of a set of genes. Virus have that, right? We know virus can have either RNA or DNA, right, as their nucleic material, but they cannot have both. You can never see a virus with both RNA and DNA. It's either they have RNA or they have what? DNA. So virus cannot be classified as a cell. First, they are just, in fact, virus is basically composed of 2 things. A protein coat and a strand of nucleic acid, which can either be RNA or DNA, is it not? Now, do you know why HIV drugs have not been found? Like, have not been produced? A drug that can cure HIV, cure. Have you seen any drug like that? There are drugs that can help, that can control, but there's no drug for now that can, and I don't think there will be any drug that can cure, because virus on its own is not a living thing. Do you get that? Virus on its own is not a living thing. If you remove virus and put it on this floor, in fact, it can be crystallized and put in substance in a container. It can stay there hundreds of years as a non-living thing. But any day it comes in contact with a living cell, it will start to multiply again. So on its own, it's not a living thing. It's only living when it comes in contact with a living cell. So now the person has virus, HIV, and you want to cure it, you want to kill the virus, something that is not living. How do you kill it? So the only thing you can do is to kill the cells around it, right? Now, one thing you need to know is this virus you are talking about, HIV. What kills them, HIV patients, is what is the full meaning of HIV? Human immune deficiency virus. That is the virus. That's HIV, is not the disease. Hope you know. AIDS is the disease, right? HIV is what causes the AIDS, is it not? HIV is a virus. Now we say human immune deficiency virus. A virus that affects the immune system, weakens the immune system. That's what it does. Once that virus enters the system, it will weaken the immune system, and once the immune system is weakened, small malaria, the person can die because the immune system, which is responsible for fighting infectious agents, is weakened already, and so anything can kill the person. By the grace of God, I've handled several HIV cases. There was one. If the truth is, if you discover it on time, you can manage it. I've given some instances here in this class, right? Good. You can manage it, but if it's already high in concentration, you'll soon have a glorious exit or call to glory. All right. Now, herpes virus and HIV. There are two antimetabolites that can be used to control or to treat them, to treat these two viruses. One is acyclovir. Acyclovir is a purine analog, looks like purine. And as you know, virus have, okay, this is a DNA virus. And DNA, you know, the building block of DNA is what? Nucleotide, right? And nucleotides contains nitrogenous base, pentose sugar, what? Phosphate group, is it not? Nitrogenous base can be purine or pyrimidine. This, as the virus is using your own energy, using your cells machinery to replicate, it will produce more, it will need to produce nucleotides, right? Bases will be needed. What this acyclovir does is, it looks like a purine. So in the virus now, as the virus is trying to produce nucleotides, this acyclovir, which looks like a purine, will be incorporated into the growing chain of the viral DNA. And as it is incorporated, thinking it is the normal purine base, as it is incorporated, it cannot be metabolized. Just like we saw in the 5-fluorouracil. The enzymes here cannot metabolize that acyclovir. And so nucleotide synthesis is inhibited. It leads to termination of that pathway. Nucleotides cannot be synthesized, and so it prevents much replication of the virus. You are not killing it, but the replication now is inhibited. Do you understand that? You can spot it. Spot it how? HIV test now, once the virus gets into your system, it circulates all through your blood. That is why if you take blood from here and test from HIV patients, you still see it there. If you take it from the leg, because once it gets into the system, you start multiplying, replicating all over your body is there. Get. And please, you have to be very careful, because once you get it, they will not ask you how did you get it. Everybody will take their assumption. You know their assumption. Please be very careful. For those of you that just see razor blade, maybe you want to sharpen your pencil, just see razor blade on the desk. And there was one day recently, I was checking my bag, putting my hands in my bag, and before I know, blood started rushing. I was now like, what is in my bag that is causing this? I checked, I didn't see anything. No, my mind said check where. I checked this bag, scattered it. I saw razor blade inside. I was like, how did razor blade get into my bag? I started thinking of all my enemies. Maybe they put a HIV razor blade in my bag. No prayer, no pray. Immediately, see how they push blood, make come. They push blood, make come out, so that if anything, please, if you see any sharp object, avoid it. You say, I look like a HIV patient. Please test yours. As you said, it's good to test yourself regularly. I told you of a time where I check myself almost every week. Almost every week, because the people in that area, most of them were HIV infected. So you treating them, you won't know this one is HIV infected. I give you an instance of when God just saved me that day. I didn't know it was HIV patient I was treating. It was later they told me. And already God saved me. So acyclovir here looks like a purine and is incorporated into the growing chain of the DNA and causes termination. That's one. You can see it tomorrow, right on the 2 antimetabolites that have been used to treat or control HIV virus and herpes virus. You now be looking me, Paul. These are the 2, acyclovir and what? 3-azido 3-deoxythymidine. You said? The name is what? 3-azido 3-deoxythymidine. Another name for it, AZT. When you write AZT, they will fix their own meaning to it. Now, this one, acyclovir, we said is a purine analog, right? AZT is a pyrimidine analog, and it blocks HIV replication by inhibiting HIV DNA polymerase. DNA polymerase is an enzyme that is involved in DNA replication. When we treat central dogma of molecular biology, we see that we take replication as heading. Very interesting part of it. All right, so basically this is it. If you forget everything we said today, don't forget that the classes of chemotherapeutic agents are: number 1, antimetabolites. Example: allopurinol, acyclovir. Next one is what? Antifolates, like what? Methotrexate. Number 3 is what? I hate them. Glutamine antagonists, right? And what? Other. Good. All right. Can we continue? And don't also forget that the 2 chemotherapeutic agents that have been used to treat HIV virus and herpes are what? You do AZT. I beg, remain some tongue like you used tomorrow, please.